Our big story this noon, a disease with no known cure will soon reach the United States for the first time. The Centers for Disease Control plan to bring 2 Americans infected with Ebola to the U.S. for treatment. Andrew Spencer reports a specifically equipped plane that's already en route for Emory Hospital in Atlanta.
There has never before been a known case of Ebola in the United States, but there will be soon. The CDC has retrofitted a long-range business jet with medical equipment, including an isolation chamber. The CDC plans to bring 2 infected Americans back to the United States. Aid workers Nancy Wrightball and Dr. Kent Brantley are currently in stable but grave condition.
These patients need to be in isolation, and that isolation needs to be pristine. Everything from the way that the air circulates in the room, the way that people are allowed to enter into the room.
At an advanced stage, Ebola can cause internal and external bleeding. The symptoms include weakness, fever, headaches, and vomiting. The World Health Organization says Ebola has infected more than 1,300 people in West Africa since March. Those cases have been more than 55% fatal. Liberia has been especially hard hit.
The government does not have the capacity anymore to deal with this outbreak, so we need the help of the international community.
Even as nations call for more help with what may be the worst ever Ebola outbreak in history, international humanitarian groups are pulling out, and the CDC has issued a level 3 travel warning for Liberia, Guinea, and Sierra Leone.
It's a recommendation that people avoid non-essential travel to those 3 locations.
There is no known cure for Ebola. There is an experimental vaccine, but testing for that vaccine isn't expected until at least September. I'm Andrew Spencer reporting.
It's not clear when the 2 patients might arrive in the U.S., but coming up in our next half hour, we learn about the new wave of concerns being generated and how health officials plan on getting the 2 Americans infected into the U.S. without the risk of exposure.